Hello there. I am Sue Landgraf. I am the new Executive Director for CFRI, and this is my first time moderating the CF Discovery Series since becoming ED in September after Carol retired. We all miss Carol, and if I know Carol, Carol is at home, and she is watching this through the streaming capability. So welcome, Carol. We are pleased that the CF Discovery Series was developed in collaboration with Carol and Camille Wasowich, nurse practitioner at the Stanford CF Adult Clinic. The CF Discovery Series was designed to make vital CF information accessible to the CF community by presenting various speakers that are experts in their fields. Before beginning, I would like to note that no information presented tonight is intended for a patient's diagnosis or treatment. As always, we urge you to work together with your healthcare team for your medical treatment. Tonight, I'm very excited to present the first portion of our presentation. Tonight's topic is nutrition and digestive health in cystic fibrosis. Thanks to Genentech and Aptalis for supporting this important evening. And thank you to Holly Devlin with Aptalis for joining us tonight. The generous support of Genentech and Aptalis pays for the venue, the studio, refreshments, and all the other costs associated with this program. So thank you very much. Tonight's program, live from the Crown Plaza Cabana in Palo Alto, is being produced by your CFRI Live team, Eric Martin, Scott Wakefield, David Suhu, and Mary Convento, who is tracking questions from our online participants. I do encourage all of you to ask questions, whether you are here in the audience or whether you are part of our online community. To those of you who are unable to join us in person tonight, we're so glad you can join us through CFRI Live. If you would like to ask any questions, though, please, you will need to register through Ustream. I'd like to introduce our first speaker, DJ Cayley, Nurse Case Manager, Bay Area Pediatric Pulmonary Children's Hospital, Oakland. And tonight she'll be speaking about nutrition and digestive care and health in CF, followed by your questions and answers. I find Deborah to be an extraordinary person. She's been caring for people with CF for 37 years, and that is an amazing feat in itself. She attended nursing school specifically to work with CF individuals. She started as a staff nurse and then went on to be the CF nurse coordinator at Children's Hospital Los Angeles for 18 years. And for the past 10 years, she's been at Children's Hospital Oakland. So let's welcome DJ Cayley. I'll trade places with you.
Thank you. I have a bum knee, so you'll excuse me if I sit while I speak. Courtesy of my 4-year-old grandson. So thank you very much for having me. It's a pleasure to be here to speak with you about a topic that is near and dear to my heart, cystic fibrosis and nutritional support. We are going to review clinical insights for digestive health management, understand the challenges associated with transition, review key components of nutrition for patients, and evaluate social and economic challenges encountered by patients with CF, and review the unique offerings and rewards of the Live to Thrive Patient Support Program. So as you may know, the gastrointestinal tract is often affected in CF. The thick mucus is secreted and there's inflammation in the GI tract, which leads to progressive destruction of the pancreas. Insufficient amounts of digestive enzymes, diminish absorptive function in the small intestine, poor digestion and absorption of food, and then growth retardation and poor nutritional status. Higher body weight has been shown to correlate with good lung function in CF, and this is something that all CF centers definitely focus on and have focused more intently in the last, I would say, 10 years or so. Many people with CF cannot digest or absorb their nutrients and fat from food due to the pancreatic insufficiency. So as you might remember, the pancreas gets clogged up with mucus and then it can't get the enzymes out to digest the food. CF patients require anywhere from 110 to 200% more calories than people who do not have CF. And they can eat all the things that the rest of us are not supposed to. High calorie, high salt, high fat, high protein. It's crucial for people with CF. Good nutrition promotes a strong immune system to fight infections, and the fewer infections you get can minimize lung damage and extend the life of people with CF. The CF Care Team dietitian plays a crucial role, and I rely on my two dietitians very heavily. So clinical guidelines for nutrition management, again, it's a high-calorie diet, including supplements when needed, behavioral intervention to encourage good eating habits in children, keeping track of nutritional indicators such as body mass index, and appropriate doses of enzymes. I want to touch just a little bit on the behavioral intervention. What we do is we work with the parents to not get stuck in that defiance attitude of the younger children. For instance, I had a patient down in LA years ago who, during her 3 to 4-year-old age, all she wanted to eat was oatmeal and Kudo bars. And her mother came to me in tears, oh my God, I'm a terrible mother. This is all she'll eat. And I said, you know what? It's working. She's growing. That's all I care about. As long as she's growing and gaining weight, great. Let her eat Kudos and oatmeal. She'll outgrow it. And she did. 90% of patients with CF have exocrine pancreatic insufficiency, or EPI, and that results in the chronic nutrient malabsorption. The symptoms of malabsorption include poor weight gain in spite of good appetite, frequent loose or large bowel movements, mucus or oil in the bowel movements, and how I like to explain that to new parents is like with babies in their diaper, you'll see a grease ring, like when you blot your pepperoni pizza with your napkin, that orange grease, that's exactly what it looks like. Excessive gas or stomach pain and distension and bloating. And also, their stool smells really, really bad from that malabsorption. And I often describe that to parents as it'll have hang time. After you have changed the diaper and taken it outside to the trash can and thrown it away, you still smell it in your house 30 minutes later. That's hang time. CF patients with pancreatic insufficiency need to take pancreatic replacement therapy with all meals and snacks in order to properly absorb the carbohydrates, proteins, and fats. And the dosing guides are based on a consensus statement, and we start out basing it on the weight, and then that's why every time you come to clinic to visit, we ask you how many poops you're having a day, and whether they sink or float, and whether you can see an oil ring, because we're trying to determine the exact right amount, and it's a fairly broad range of using enough enzymes to keep you growing and keep your stools normal, and without going over to where it's too much, where you could get something called fibrosing colonopathy. Vitamins and minerals are necessary for normal growth, function, and health, and CF patients need even more, particularly the fat-soluble vitamins. So because CF patients do not absorb the fat properly in their diet, they also have trouble with fat-soluble vitamins, which is A, D, E, and K. Thus, the vitamin supplement called ADEC, the old name, the new name is Aquadec. So A is good for your vision and bone and tooth formation. D is improved building and maintaining strong bones and teeth. But the latest research actually in asthma has shown that vitamin D insufficiency is harder on your lungs. So vitamin D sufficient, if you have adequate vitamin D stores, it actually helps protect your lungs and helps reduce the inflammation in the lungs. So it's really important to have your D level checked and make sure you have plenty of vitamin D. Vitamin E helps keep red blood cells healthy, fights infection, maintains healthy intestines. Vitamin K is the role in blood clotting and keeping bones healthy. You also need calcium, essential element for building strong bones and teeth. Years ago, when I first started CF, we pretty much didn't see people make it to 15 or 16. And so we didn't have to worry about things like osteoporosis. And thank God now we do have to worry about them, because that means you guys are living longer and you're reaching normal lifespans. And we do have to worry about your calcium intake. Iron is essential in oxygenating the blood tissues. So if you are iron deficient or anemic, you don't carry the blood cells to oxygenate your tissues as well. Sodium chloride is important in maintaining fluid balance. People with CF lose up to 5 times the amount of salt in their sweat, and therefore dehydration and heat stroke and heat prostration are always a risk, especially if you live in a very hot climate. And zinc. This is many important functions in the body, from growth and healing to taste and appetite. As a matter of fact, I was very privileged. We had a very good dietitian in LA who did a lot of research into zinc and taste, and found that our zinc deficient patients had a harder time gaining weight because they just couldn't taste the food. And once we boosted their zinc levels, they ate more because the food actually tasted good to them. Patients with CF are living longer than ever, as I said. In 2011, the median predicted survival age was 36.8 years, compared with less than 28 years in 1987. And the number of adults is increasing. In 2011, more than 48% of patients were adults, compared to 32% in 1991. With advances in treatment, CF patients are living longer and creating new challenges in care. And among those are nutritional challenges, such as cystic fibrosis-related diabetes and bone disease have emerged. The CF care team plays an important role in addressing CF-related life changes. And because patients are living longer well into adulthood, there are unique issues that arise around the transition from pediatric to adult CF care. And this period of time is challenging for the care team, the caregivers, and the patient. When I first started, we basically considered CF womb to tomb, because we had you all of your life in the pediatric department, because there weren't adult practitioners that knew how to take care of CF. And then as we saw that people were living longer and needing more adult-based support, the pediatric community went out, and the CF Foundation went out and started encouraging adult pulmonologists and GI people to learn CF and to take these people on as they aged, so that they got as good a comprehensive care from the adult world as they did from the pediatric world. And it was challenging for us pediatric people, because we loved our patients and we didn't like to see them go. But in retrospect, I have become a believer, and I now look forward to you graduating and going off to the adult center, because it's a rite of passage, and it means we did our job well in pediatrics. For CF care teams responsible for the pediatric to adult CF care, the transition is an ongoing process over a period of time, and multiple components of care that must be addressed, and each care team member has a unique role to play. In our center, we start really from diagnosis and telling the children about their disease and what the pathophysiology is and their medicines. And by age 8, they are given a binder and they are told to start learning the names of their meds and what they do and the frequencies. And by the time they're 13, we start meeting with them alone so that they can tell us any concerns they have, and know that we won't tell their parent. I always call it the sex, drugs, and rock and roll talk. And then by 16, we like them to be calling me themselves when they're sick, instead of having mom or dad call to get a sick plan, and to call me for appointments and to call me for refills. And we start teaching them in preparation for college about insurance and how to get a job that is appropriate and how to get proper insurance once you have a job, and to go off for college, that we like them to think of their CF care as actually one class. And because that's how much time per day they're going to spend on their CF care. It's equal to one course. So they need to figure that into their timing. Challenges for patients with an adult services is the independence in decision-making, goal setting, and issues of confidentiality and privacy. Many CF patients and parents have a really hard time letting go. And it's hard when you have taken care of your child for a long time to then suddenly let go of the control and let them be in control and do all the talking and be the one that goes to see the adult provider. You need to establish good communication and develop a good relationship, and hopefully what we do at our center works. We start talking about the adult center when they're very young. And we collaborate with our adult center and have them at many of our events so that the patients actually see them and get to know who they are long before it's ever an issue about transitioning to the adult center. The perception and patient concerns, they're not familiar with the adult staff. So if you have these collaborations early on, they do get to know them, and there's less anxiety about transitioning. And the patient has strong relations with the pediatric staff because obviously we got them when they were basically newborns and we had them until they're 21. So it's hard to move on. Patient is reluctant to leave the pediatric care setting because, hey, a pediatric hospital is a pretty nice place to be. There are pictures of Mickey Mouse on the wall. It's not all gray, dull pictures and lots of quiet and silence. It's a pretty rowdy place to be. And sometimes it's actually a fun place to be. Also, sometimes the patient can have difficulty taking on responsibilities for self-care, but hopefully if you've started a transition program early on and taught them from a young age up how to take care of themselves, those will not be an issue. Nutrition and digestive health are essential components of care for the patient with CF. We want to achieve nutrition and digestive health, and we want the patient to grow normally as compared to any other child who does not have CF. So the dietitians at the CF Center can provide specially tailored dietary programs for each stage of life. And what we also try to do is work within their culture. And if there's certain types of foods that maybe are not the typical American diet, our dietitian will work with the family to use their culturally appropriate foods and add calories and protein and fat to that in order for them to gain sufficient weight. Social and economic considerations. CF imposes a burden on everyday life, especially around cost of care, and I do case management, so this is really where my focus comes in with the patients as well. A lifetime cost of treatment for a person with CF can be $2.3 million, and the total annual medical care expenditures is $48,000, which is more than 22 times the average cost for people without CF. 1 in 4 patients delay care because of the cost. And if they're also non-adherent to their treatments, it can add to the economic burden. So they're not getting their meds because they can't afford it, or they're saving their meds and maybe only taking half the dose trying to make it last because they can't afford it. And these things then produce more economic burden in reality because they're wasting medicine that they're not using. And it can also cause increased clinic appointments, emergency room visits, and hospitalizations. Improvements in care and life expectancy has led to a larger number of patients with CF seeking higher education, vocational training, and employment. And according to the 2011 CF registry, 45% of adult patients with CF were employed full-time or part-time. One of the things that I really like to do when I meet a new family, because if they go on the internet and they see old information, they hear the doom and gloom of CF from 37 years ago when people rarely made it to age 15. So one of the things I like to tell them is that I'm going to dance at their child's wedding, because I know that they're going to grow up and go on and move on. Economic and health considerations can impact employment decisions, so we do counsel them about what type of jobs to get, how to evaluate the insurance program that their employer offers so that they get the most bang for their buck. Still, employment for some people with CF can be challenging because the time required for all the daily treatment regimen and any activity limitations due to disease progress, the possibility of missed work days for hospitalization, concerns about telling employers, risks of infection or pulmonary irritants in the workplace can all play a role in what job you choose. And there may be lack of formal job counseling from the CF clinician. Some patients with CF are unable to maintain private insurance because of their disease. And there's the Cystic Fibrosis Patient Assistance Foundation, which helps people living with CF get their prescribed drugs, devices, regardless of health insurance coverage or financial resources. And I would encourage you to talk to your nurse coordinator or case manager at your center, because as my patients know, I'm a pit bull when it comes to dealing with insurance companies. I love to bend them to my will and make them pay for things. And I don't care if I have to sit on hold for an hour and a half. I have been known to do that. I learned to multitask. Additional resources may be needed. Healthcare professionals can play an important role in helping you obtain insurance coverage and other financial assistance that you may need. Often, a lot of our drug vendors have copay assistance programs, things like that, and your CF social worker and nurse coordinator are the person who would know the most about those programs and be able to help you. Again, the CF team plays a pivotal role in transition solutions management. Transition solutions include implementing standard programs in the care center for transfer of adults. And like I said before, we interact with the patient on their own without the parent. We try to teach them to advocate for themselves and discuss adult issues, including the management of bills and vocations. Providing job support and counseling is part of a self-management and healthcare transition program. Teaching patients how to save recipes, create a meal plan, build grocery lists, and cook to meet their nutritional needs. Our dietitian at every visit gives the family handouts on how to increase calories and get extra nutrition in fun ways that are not going to make you feel like you have to eat. Helping patients navigate insurance obstacles, letters of medical necessity. I spend a lot of time writing those. Prior authorizations, insurance appeals, exceptions, and reconsiderations. Like I said, get to your nurse or your social worker. They're the ones that know how to go to bat for these things. As you can see here, there are lots of different resources. The CF Foundation has all of these on their website you can always find. There are high-calorie recipes for nutrition, the Patient Assistance Foundation, the Patient Assistance Resource Library, and the CF Legal Hotline. If you are looking to get disability or Social Security, SSI, Social Security supplemental income, that the CF Legal Hotline is the place I always refer my patients to, because I'm pretty good at it. They're really good at it, and they get a lot of faster results than I do. I'm going to skip over this. So, Aptalis has the Live to Thrive program, and it's a comprehensive support program for patients with CF, their loved ones, and caregivers. It's an online community designed to help patients of all ages manage their condition. It's to help educate patients and caregivers about living with CF and the importance of good nutrition, motivate and encourage members to keep up with their treatment. There's convenient enrollment online or by phone. It's a hassle-free system, no additional paperwork or forms to fill out or mail in, which I appreciate very much. Thank you. Toll-free numbers for program questions. You can get free Aptalis pancreatic enzyme product for eligible patients up to 24 months of age, a savings card to help with co-pays, age-specific educational content for managing CF and supporting nutritional health, free vitamins and supplements shipped automatically each month, and a points-based reward redemption program. As of March 2013, Aptalis has saved patients an estimated $1.1 million. Thank you very much. Choosing or changing vitamins and supplements is easy, online or through a toll-free number. So there's Aquadex that are out there. There are different vitamins that, some people like the gel cap, some people like the chewable. They don't like this one, they don't like that one. Aptalis can help you figure out which vitamin you like and get that for you for free, because the insurance companies often don't pay for that, even though I yell and scream at them. Scandi Shakes is a calorie-rich shake which can be mixed into many foods and beverages. Scandi Cal is a powder that is calorie-rich and you can just shake it on your food. And Boost VHC, which stands for very high calorie, is a calorie-dense, nutritionally complete beverage, and you can get automatic monthly shipments. They offer diverse educational and interactive content, general content about living with CF to help patients and caregivers better understand the disease, providing tips for managing the condition, and age-specific interactive content such as quizzes and video on CF and nutrition for tykes and tweens, teens, and adults. And studies have shown that the more you know and understand about your disease and why you have to do what you do, the more adherent you will be to the plan. Understanding CF is a general education overview of what is CF, what to expect with CF and pancreatic insufficiency, tips for managing CF including lung care, nutrition, and enzymes. They have age-specific interactive content, again, for newborns to 12 years of age, 13 to 17, and 18 and older. And there's videos and quizzes and even a cooking video, support groups. So please make use of these resources that are available to you, because I know it's hard to live with CF. And I know that with infection control guidelines now, it's even a little harder because you can't go and visit your other CF friends anymore like you used to. So it's nice to have a support group online. Facts about nutrition. There's nutrition information presented in a teen-friendly language with videos capturing patient and parent discussions on nutrition and CF, and a quiz to reinforce learning and earn rewards points. There's food for thought, which is smart food choices for ages 13 to 17. A discussion on pancreatic enzymes, a video of parents discussing their children's CF treatments, video to see how teens manage pancreatic enzymes and treatment, and tips for taking enzymes. I know with some of my teens, they're very embarrassed to take their lunchtime at school enzymes. That's the big problem we find. And so this can give you tips for explaining to people what this is, why you take them, or tips for just doing it discreetly. There are tasty treats, downloadable Scandi Shake recipes for maintaining weight. There's a celebrity chef, Fabio Viviani, preparing breakfast pizza and a downloadable recipe for the breakfast pizza. Members can earn points through taking the educational quizzes, watching supportive and encouraging videos, and filling eligible pancreatic enzyme prescriptions. Trade-in points can be used for health-related items such as a pedometer, a spacer for your inhaler, Bubbles the Fish pediatric masks, PARI nebulizers, and a heart rate monitor. Live to Thrive is a comprehensive program for patients with CF and their loved ones and caregivers. It's an online community designed to help patients of all ages manage their condition, and the benefits include copay savings, pancreatic enzyme products for eligible patients, free vitamins and supplements, and age-specific interactive educational content for managing your CF with supporting nutritional health. So, to summarize, we went over gastrointestinal tract is often affected in CF, leading to deficits in growth and poor nutritional status. 90% of people with CF have pancreatic insufficiency, causing malabsorption and maldigestion. Optimizing nutritional status in CF patients is critical to extending life expectancy. Clinical guidelines for nutrition management in CF recommended a high-calorie diet along with appropriate doses of enzymes with every meal. Each member of the multidisciplinary CF care team plays an important role in optimizing patients' nutritional status. CF care advancements have led to an aging CF population, which poses new challenges in care, particularly around CF-related complications and transition of care from teen to adult. Transition is a multi-step, multidisciplinary, and ongoing process, and the CF team can provide effective transition solutions that address the patient's physical, emotional, and even financial concerns. You can enroll for the Live to Thrive online at www.live2thrive.org or by phone at 866-520-8032. Thank you for your time, and if you have any questions, I'll be happy to answer them.
Do you have any questions? Yes.
Hi,
I'm sorry, go ahead.
Hi, we have an online question from Leslie. She would like to ask about the safety of Miralax and if there are any more natural alternatives to help fight blockage.
Yes, thank you. Excellent question. Miralax is extremely safe. We've had very good results with it because it, despite sounding like it is an actual laxative, what it does is it just brings more water into the bowel to soften the stool and move it along. So it is extremely safe. As far as natural products, we encourage a diet high in fruits and vegetables and fiber that many patients get by and don't need Miralax with.
Oh, thank you. My question has to do with one of your charts that I didn't quite understand, I think. It showed, I think, as children age, they actually become less healthy or more at risk for not following proper protocols. Was that the gist of the chart?
Correct, and that's the teenagers. Because teenagers, as I often tell my families, it's not you, it's their job. Their developmental job is to think they know it all, and their parents are the stupidest people on earth, and their developmental job also, if you study growth and development, they think they're invincible and that nothing will affect them. So they often run off the rails during puberty, and it's a constant job of the parents and the CF team to try and get as much adherence as we can. And one of my jobs that I just took on personally is to try and compromise with them and figure out ways of getting them to do, okay, well, we can eliminate this particular medicine if you'll do this medicine. So I try to reason with them.
Thank you.
Thanks, DJ. Your presentation brought back a lot of memories for me because I have a 29-year-old daughter, and she wasn't diagnosed until she was 22 months old. So I was the organic mommy who made baby food, and she never ate candy or any fats, and as soon as she was diagnosed, boom, potato chips, French fries, everything that you typically don't want your child to eat. So my question is, this is how a typical CF individual gains weight. But what about the other side effects now that they are living longer? There's hypertension, there's high cholesterol, there's diabetes. How do you manage the CF diet in relationship to all of the adverse side effects that can come along with eating those types of foods?
Excellent question. There is a protective mechanism because of the malabsorption or the pancreatic insufficiency. People with CF tend to have low cholesterol. So it is not an issue, although I have seen a couple of patients who had genetically high cholesterol and we had to adapt for that. But for the most part, cholesterol is not a worry for the average person with CF. And with the diabetes also, the diabetes is actually another animal compared to what the average person thinks of insulin-dependent diabetes. We teach them carb counting, and we still encourage that high-calorie, high-fat, high-protein diet. They just have to adjust their insulin and figure in their exercise and their carb counting.
And then often chase the highs with insulin if they don't have it correctly because they've stuck in another kind of ice cream or something?
Yes. They do. The question was, do they have to counter their highs or their lows in insulin? And yes, that is a very big thing because they can drop suddenly, and so we often encourage them to, actually if they're out on the go, we have them keep a little tube of frosting that they can just, if they're driving, they can just quickly grab it and take the frosting, and it'll it'll get rid of use up the insulin for them.
I have another question. See, I really did find this fascinating, and I'm going to mispronounce this. You had mentioned something that I had not heard of. Fibrosis?
Fibrosing colonopathy?
Yes.
Okay,
And so what is that, and what are the long-term implications of
Sure.
something like that?
So some people, and I think it's 5% of people born with CF get something called meconium ileus. And meconium is that thick, sticky green poop that a baby first poops out. And with CF, if you have meconium ileus, that stuff gets stuck in the bowel. And you actually, they might have to give enemas to get rid of it, or in very rare cases, they actually have to surgically remove part of the bowel to get rid of it. So later in life, you can get what's called distal ileal obstruction syndrome. We used to call it meconium ileus equivalent. So the intestine is lined with mucus. Mucus is thick and sticky in CF. It's thick and sticky in the lungs. It's thick and sticky in the bowel. So they can get bowel obstructions from that. Later on, we found years ago when they tried to make the big number enzymes in the 20s and 25s and 30s even, so that you didn't have to take as many capsules, they found that it was too much of a dose of enzyme, and it caused this fibrosing colonopathy, where they would get this bowel obstruction that couldn't be relieved. So then they went back to lower doses of enzymes. So now that we are very conscious of calculating enzyme doses based on your weight and your intake, so that we don't throw anybody into fibrosing colonopathy, because we certainly don't want to cause any more problems than someone with CF already has.
Thank you.
And
So DJ, was it just the higher concentration of enzyme pill, or they were just taking too much over what they were supposed to take for their weight and height?
I am not sure. I didn't actually see many cases of it. In our centers where I was working, but it's overall, it's too much enzyme in general, not even necessarily farther weight, but yes, it is further weight as well. Do you understand what I'm saying? That
it's at a meal and their total daily dose.
Right, and so now actually often we calculate, matter of fact, we do always calculate, and we tell the patient, okay, you need to take this many with meals, this many with snacks, but this number is the amount, it's the absolute maximum, do not go over this amount for the whole day. And just an interesting anecdote for the gentleman who asked about the teenagers. And I'm not sure that this is still true, but teenage girls used to do worse than teenage boys because the girls were trying to be girls and they were suppressing their cough. And the boys it was a badge of honor to hawk up a loogie in front of people. And so the girls did worse because they were always suppressing and not getting the stuff out.
So my question now is, without diving into the politics of the issue, does the Affordable Care Act provide a lot of assistance to the problems that you were presenting here with regard to costs of medications and insurability?
It does, actually. And actually, the CF Foundation have had several webinars for us to go in and listen to about this very subject so that we know how to maneuver around it. So obviously, one of the nice things about the Affordable Care Act is the bit about the pre-existing condition. So that's definitely very important to all of my patients, that they can't be denied insurance because of their CF. Also, that, sorry, lost my train of thought.
Age 26.
Yeah, age 20, thank you, that's exactly what also that they can be covered up to age 26 on their parents' plan. So they can be covered longer, and then by the time, because sometimes people with CF who have a little more moderate to severe lung disease, it may take them a little longer to get through college because they can't take full-time courses. So it's really nice that they can be on their parents' policy until they're age 26, and then they can get out and find a job and get coverage of their own.
So then DJ, and back up to Liz's question then, so usually when patients are under 21, they have Medi-Cal, and then once they turn 21, it's GHPP, unless they have another option, but if going on their parents' plan is better than GHPP, they should do that, or should they apply for both?
Okay. GHPP, for anyone who does not know, is the Genetically Handicapped Persons Program, and that is specific here to California. So many states do not have that and have any sort of program to help people over the age of 21. They are just straight on Medicare, or Medi-Cal, or Medicaid, excuse me, in other states. You know, California, we're very proud of our state, and so we nickname everything to do with California. So with that, yes, it would definitely be better to stay on your parents' insurance. Private insurance can be a blessing and a curse to the case manager, because sometimes you have to jump through more hoops to get certain medicines, but usually, like I said, I can bend them to my will. Whereas California, our Children's Services, our Medicaid, Medi-Cal, our GHPP, pretty much will pay for anything that is standard CF care without a hassle, and you don't have a copay. So, but still, private insurance ultimately always is better. Thank you very much.
Well, I thought that was really fascinating. Brought back a lot of memories, and I learned a lot of new things. So thank you very much, DJ. I'm sure you all appreciated her presentation, too. Lots of just great information to absorb and take home with us. Next, I'd like to introduce you to Stacy Motenko. And Stacy is a CF patient advocate from Southern California, and she's coming to us via a video clip that she produced. And she's going to share some of her experience on nutrition and growing up with cystic fibrosis. So if you do have questions for Stacy, you'll have to submit them online to Stacy, and she will respond to you. So bear with me while I put this down on the floor.
Hi, my name is Stacy Motenko, and I am the Cystic Fibrosis Patient Advocate for Modern Health Specialty Pharmacy. And I also have cystic fibrosis. I want to say a special thank you before I start to CFRI for putting on this Discovery Series, and to Aptalis for partnering with us on this Discovery Series. And as I mentioned, I have cystic fibrosis. I was diagnosed at birth, or actually technically a month before I was supposed to be born. My mom had to have an emergency C-section, and then I had to have emergency surgery to remove half of my small intestine because it had ruptured due to a blockage. And that was the first indication that doctors had that I probably had cystic fibrosis, which sure enough, a few months later, they found out that I did. But I have had a lot of digestive issues throughout my life, and that's why this topic today of nutrition and digestive health is very important to me, and I'm very passionate about it. So I'm very excited to be able to share with you guys tonight from my personal experiences dealing with CF, and also in my work as a patient advocate. I talk to lots and lots of patients with CF every day, and so I have feedback from their experiences as well. As much as living with cystic fibrosis for the past 27 years should qualify me as a medical expert, I really am not. And so I just want to point out that I am not trying to give any sort of medical advice, and to always consult with your physician if you're making any changes in your care routine. But I did want to tell you a little bit about my experience with digestive issues growing up and what I did that was very helpful. So basically, growing up, I had a lot of problem gaining weight. I was very underweight, and I really had a hard time putting on the weight. And it did get to the point where my doctors said we should be considering a feeding tube, and that really motivated me to try even harder to put on the weight and to eat very high-calorie diet and be really adamant about my enzymes and all the other things part of my digestive health so that I could put on that weight. And luckily I was able to, but I know from talking to a lot of other CF patients that that's not always the case. But for me, I really did stress that high-calorie diet. I was known to eat Haagen-Dazs ice cream with peanut butter almost every single day. Not that I'm suggesting you do that, but I just tried my very best to eat as much as I could, but also to eat healthy. And I did use supplements to add calories to the foods that I was already eating. So, for example, Scandical, it's a powder that you can pour in your food. It's tasteless, and it helps just add calories. Things like that, or Scandi shakes. There are a lot of supplements out there to add extra calories to the food that you're eating. So that was one thing that was very helpful to me. But one thing I do want to stress is that eating a high-calorie diet doesn't necessarily mean eating an unhealthy diet. I know that diet and nutrition is very important for cystic fibrosis, and as we've seen today, your digestive health has a strong correlation to your overall health and your lung function, so it's very important to have that weight on and to be eating healthy and to be healthy. So definitely want to eat high calorie, but at the same time eat healthy. And the dietitian at your Cystic Fibrosis Center is a wonderful resource in helping you figure out what are the good things to be eating and what are things that you can be eating that are going to give you those extra calories in your day. And as I mentioned, the enzymes are certainly a big part of what has helped me to stay healthy and to gain that weight that I needed. And with the pancreatic enzymes, something that my doctors always told me, and what I've heard a lot from the CF community, is that it's very important to take those enzymes at the beginning of the meal, or the beginning of when you're going to be eating, and that's when they really are most effective in your body. And I would say absolutely, talk to your doctor if you don't feel like the enzymes that you're taking are working for you, because there are a lot of different enzymes out there, and sometimes it takes a little bit of playing around with different ones to find the one that helps you. And sometimes it can even be a combination of enzymes that doctors put together that's going to be, the ultimate key to help you with your health. But I would also recommend just kind of noting any patterns or trends in your digestive health, stomach aches, issues like that, so that you really can communicate most effectively with your physician when you see them, so that they can really put you on the right medications for your stomach. Sometimes it can be also helpful to keep a food log and to log all the things that you eat, so that when you meet with your dietitian, you can show them what you're eating, and they can help you figure out, like I said, a good meal plan of things that you should or should not be eating for your health. Well, the focus of the CF diet is usually on having a high-calorie, high-fat diet to gain weight. I also want to stress the importance of vitamins and minerals into your diet, and that although we take lots of supplements, for cystic fibrosis with vitamins and minerals, I think it's also really important to eat those fruits and vegetables and eat those healthy foods in your diet to get those vitamins and minerals the most natural way possible. So I would certainly suggest talking to your dietitian about what foods you can eat that contain those really vital vitamins and minerals, and really trying to incorporate those into your high-fat, high-calorie diet as well. As I mentioned, growing up with cystic fibrosis was very difficult, and one of the biggest reasons for that for me personally was my gastrointestinal issues, my digestive issues. I had a lot of stomach aches. In high school, I'd say I missed 2 to 3 days of school per week, almost due in large part to stomach aches and intestinal blockages, other similar digestive issues. But the reason I'm telling you this is because I kind of started to accept that that was my norm, and that that's how I was going to feel. I was always going to have stomach aches and be suffering. And I'm telling you this because I really don't want other patients and families to make that same mistake as I did in thinking that, because I was wrong. There was a better quality of life out there for me, and it took me being really proactive and really pushing my doctors to help me figure out what was wrong and how I could fix it and have a better quality of life, which I'm really happy to say I do now. I have a lot less digestive issues than I did in the past, and I'm much healthier and happier as a result. And so I really want to stress to you that it's very important that you be your own advocate, or be your child's advocate. You need to ask the doctor questions, you need to push them to give you the best quality of life possible. And you need to also keep good track of your health so that you can communicate most effectively with your doctor, and so that they can help you to the best of their ability. The cost of cystic fibrosis is very high, between all the medications, the equipment, the hospitalizations, doctor's visits, etc., etc. It's just a very high-cost disease, and it's very hard to manage at times. And so I just want to make sure that patients and families are aware that there are a lot of patient assistance programs out there for the cystic fibrosis community to help make life better for you. And we've heard a lot tonight about the Live to Thrive program, which is an amazing program and a great example of a patient assistance program that is out there to help the CF community. So make sure that you really research and find out about these programs so that you can get involved with what's going to be the most helpful to you. And if you have any questions or need any information about these kinds of programs, I'm always available to you, and I'll put up my contact information so that you have that. And here at Modern Health Specialty Pharmacy and all the other specialty pharmacies out there for cystic fibrosis, our goal really is to help improve quality of life for the patients, to make things easier for you guys, and really please don't hesitate to reach out and to utilize us as a resource in these patient assistance programs and in your overall health, to just make sure that you are having the best quality of life possible. So thank you so much for your time this evening, and I really hope you have a wonderful rest of the night.
Wow, that was extraordinary. I think that's the first time we've had a video clip like that, David,
Yep.
at least that I can remember. Thank you all very much for being with us tonight. We have a full house. It's wonderful to see everybody, and good to see you. DJ, again, thank you so very much for coming over and giving us your time tonight. It was really a very valuable talk. and Stacy did a tremendous job as well, so we appreciate everybody's participation. So thank you for joining us for our CF Discovery Series on nutrition and digestive health in cystic fibrosis. Also, I'd like to thank again Genentech and Aptalis for their support, because we could not do this without them. The next CF Discovery Series will be on December 10th, and I hope that you can join us here or online. And just a reminder, I'm just going to ask you one more time, if you could take a few minutes and fill out the evaluation forms for us, and we will collect them. That's very important for us. Again, we appreciate you coming tonight. Thank you very much. Thank you to our CFRI Live team. And I'd like to say a special welcome to Bill Holt, our president of the CFRI Board of Directors. So thank you, Bill, for coming. And please help yourself to some nice snacks over here before you leave. So thank you very, very much.